Hi, this is Dr. Paul Goldberg of the Goldberg Tenor Clinic in Atlanta, Georgia. You're going to shortly be seeing an interview with our patient Tom Shattuck and Dr. David Tenor, where they're going to tell the story of Tom's remarkable reversal of rheumatoid arthritis, which he was diagnosed with back in 2015. Tom came to see us in 2016 with all the typical complaints people have with rheumatoid arthritis: joint stiffness, fatigue, low libido, arthritic pain. And at the time, Tom had been seeing a medical rheumatologist. He was on a cocktail of drugs, including methotrexate and Plaquenil and steroids. And over a period of 2 years of hard work after going through a biohygienic program unique to the Goldberg Tenor Clinic, which I created partially as a result of having rheumatoid arthritis myself back in the 1970s. Tom made a very valiant and remarkable recovery, completely undoing all the damage and severe pain that he was in. And today, full and active life, playing baseball, leading an active life with his wife Julie. And the remarkable thing about it is that Tom not only got well, got off all the drugs, came back to an active life, but has maintained that now for a period of 5 years. Perseverance in all these cases is important. When you have a chronic disease, you have to be ready to undergo a thorough investigation to find out the real causes of why you're sick, implement the right strategies individually applied for that person, and then have the perseverance, the will to get well, is what I say. The will to get well, to push that through and to get well, and then realize that you can't go back to old ways. You have to lead a healthful life, and who wouldn't want to? Having all the joys of living again, waking up and feeling refreshed, not having any joint pains, having good digestion, having a strong libido, able to actively be in sports like Tom is now. So without further ado, here's Dr. David Tenor interviewing Tom Shattuck 5 years after Tom initially presented at the Goldberg Tenor Clinic.
Hi, this is Dr. David Tenor, and we are here at the Goldberg Tenor Clinic, where we specialize in the reversal of chronic disease. And I'm delighted to be joined today by Tom and Julie Shattuck. Tom came to see us from Illinois in 2016. Today is April 22nd, 2021. So it's been 5 years. And Tom has a remarkable story to share. He was originally diagnosed with rheumatoid arthritis. He was on a number of medications when he came in. And Tom is doing excellent now. He's going to give us an update as to what his status is. So Tom, just briefly tell us a little bit about what brought you in originally 5 years ago and what was going on at that time.
Well, at that time I had been dealing with, as you mentioned, a diagnosis of rheumatoid arthritis, and had the classic symptoms. I had a lot of swelling and pain in the knees, and at times in my ankles, in my elbows, in my fingers, my toes. I think at my first rheumatologist appointment that I had 16 swollen joints at that point when it was really bad. That's kind of my benchmark as the low point for me. Mm-hmm. And throughout in my reading, I came across an article by Dr. Goldberg that he had written, and that's how I got onto the Goldberg Tenor website and learned about other patients' success stories and learned about Dr. Goldberg's history with this disease. And it just really struck me as to if these other patients can improve their health and really reduce the symptoms or eliminate them, maybe that's something that I could do. And so I called and scheduled the first visit in 2016. And as I sit here today, it's very hard for me to believe it's been almost 5 years since that point. It's been a very long process for me. A lot of ups and downs along the way, there's no question about that. But Dr. Tenor and Dr. Goldberg have guided me and helped me tremendously in ways that I early on I would have never imagined that where I'm at today that I could be here, as bad as I felt when I first started out. I've also had my wife Julie right at my side this whole time through this, which for me is so important, has been so important. And I have a very strong faith in God and Jesus, and He has, my Lord and Savior has given me strength that I never knew that I had to fight through this and persevere and not quit. So with that and with Julie's help at my side every step of the way, and Dr. Goldberg and Dr. Tenner's guidance, I'm at a very, very good place at this point.
Yeah, Tom, when he originally came in, this is something I remember rather clearly. He was in bad shape, and one of the things that really made his life difficult was not only the debilitating nature of the pain and the discomfort, but just not being able to engage in things that he enjoyed. One of those things, I remember you telling me, was that you hoped to get back to playing baseball one day, but that seemed like a far long shot in light of the prognosis you were given medically. Tom was on prednisone when he came in, methotrexate, Plaquenil. He'd also taken sulfasalazine, so he was being medicated heavily, and his outlook for the future was fairly bleak. In most cases, we see when patients take a medical course where they're on these drugs, their condition continues to worsen and they develop new side effects, and they continue to go downhill over time. I'm delighted. Tom sent me an email a couple weeks ago before he came in today. He sent us some pictures. There's a whole book of them right here. We'll show a few of them where he's out now playing baseball. He's drug-free, right?
That's correct. I have been drug-free since October of 2018.
And he's now playing baseball, throwing ball, batting, running the bases.
Playing the outfield. all the things that I did for about 15 or 16 years before I got ill. And I missed 4 years of playing. I play in a men's baseball league back in my hometown in Bloomington, Illinois. And I missed 4 seasons. And honestly, back when I was going through the severe symptoms, I thought, I can't even walk without a limp. I'll probably never be able to run. I'd never imagine I could run again, much less play baseball. And so I returned to playing ball in 2019 in the fall. I played also last year in the fall of 20. In the men's league, and then I got to play at the Field of Dreams, Dyersville, Iowa, last May, which was what these pictures are showing, and I'm just having a ball. I got back to my old self and doing things that I just missed doing so much when I couldn't.
One thing I really want to emphasize about Tom in his case and his story, where he's now recovered from a chronic health issue that medically they say is irreversible. People don't get well from these issues. They're going to have to be on drugs the rest of their life. Tom is an example that that does not have to happen if we do the right things. And in working with Tom, he showed a tremendous amount of patience, perseverance, and put forth a significant amount of effort through, as he already described, a number of ups and downs, and working to get off drugs and the withdrawal that involved. And most patients are not willing to go through those types of periods to get well. Most people want to get well immediately. They want an immediate fix, which is why most people end up on drugs. Tom really wanted to go for the real, which is what we do here, where rather than cover up symptoms and treat symptoms, we set about recreating the body, literally rebuilding the body from scratch, like you would doing a renovation on a house, as we discussed before, whereby we take the old diseased tissues that are in fear, have drugs built up in them, and unload them, and then rebuild new tissues over time, and the body literally goes through a metamorphosis. So now 5 years later, Tom has new cells, new tissues, ones that are a lot healthier and function a lot better. Tom even looks about 5 or 10 years younger than when he first came in. He's got good muscle tone, he's strong, his skin is clear, he's got a glow to him. I mean, he really is the embodiment of health now. This is not, drug suppression or alternative, treatment suppression, but literally working to recreate the body and rebuild it. And the ultimate result is that Tom is in excellent health now. His blood results have been excellent, his inflammatory markers, he's off all drugs. Yeah, Julie, tell us a little bit about your experience watching Tom go through this process too, and what that's entailed.
Oh gosh, it's been really miraculous to see the change in him. And it's not an overnight thing, of course, but some days he really, honestly, I could say has more energy than I do. So just to watch, like we talked about perseverance, I've never seen it in anybody like him before. And it's just been amazing. And I think he's just so grateful, to feel good, I think that's part of the glowing about him. He just feels so good, and he's just so anxious to tell people how good he feels, and just grateful, I think, to have his health back. And it's just been an amazing thing. So
Wonderful. And certainly Julie's support for Tom was a big part of that. Having the support of family, particularly the spouse of the patients that we work with, plays such a huge role. As the patient goes through some difficult periods in the process of getting well, they need that support from those around them. So Julie was also instrumental in the success that Tom has achieved. So Tom, thank you. Really, thank you for sharing your story. It will certainly serve as an inspiration to other people suffering with the same issues and other patients we're working with, to help keep them on course, to have faith, trust the process, and see this through, give it the time needed to really get well. So
Well,
thank you.
I thank you, Dr. Tenner, and I also want to thank Dr. Goldberg. I honestly feel like the two of you helped me and guided me in this process in a way that I really, truly needed that guidance, and it just empowered me along each time each step of the way. It empowered me to keep pushing forward, and there was hope. At the beginning, there was hope, and now I'm seeing that there's actually tangible results from that process.
Wonderful. Well, thank you for sharing your story, Tom. Julie, appreciate you taking part as well, and we look forward to Tom continuing to stay healthy for the future.
Thank you.